All things grow with love. The more love, the more they will grow. It is international established fact. Now, host pathogen relationships, it is altered by the antimicrobial drugs. So the first is alteration of the tissue response. The inflammatory response of the tissue to the infection is altered when drug suppresses multiplication of the organism but not eliminate them from the body, so they are still inside the body. An acute process is transformed into a chronic one. Now, alteration of the immune response, if an infection is modified by an antimicrobial drug, pharyngeal infects with the hemolytic group A streptococcus is followed by development of the anti-streptococcal antibodies, which are going to have very bad effect on the human body. In case of the hyperimmune response, infection is followed by rheumatic fever. If infection treated early and completely, no immune response can occur and the rheumatic fever can be prevented. Drugs and dosage that eradicate infective streptococci are more effective than those which just suppress microorganism temporarily, tetracycline, and it will allow the antibodies, antistreptolysin, and the rheumatic fever. Alteration of the microbial flora. Antimicrobial drugs affect the normal microbial flora. An imbalance is created that itself lead to the disease. Examples are in hospitalized patient on antimicrobials or antibiotics, normal microbial flora is suppressed. So the organism more prevalent in the environment there in the hospital, like drug-resistant gram-negative aerobic bacteria like Pseudomonas and Staphylococcus. These organisms produce serious drug infection, resistant drug infection in these people. In women on oral antibiotic, normal vaginal flora is suppressed, causing overgrowth of the candida, causing local inflammation or vulvovaginitis and itching. In presence of the urinary tract obstruction, urinary tract infection due to the sensitive microorganism like E. coli is treated well. But reinfection due to another drug-resistant gram-negative bacillus can occur. Same happens in respiratory tract, superinfection in patient of the chronic bronchitis. We give the antibiotics, it suppress some bacteria but allow the superadded infection by the more serious bacteria to cause more serious problem. The drug-resistant organism in bowel can cause serious enterocolitis due to Clostridium difficile and overgrowth of bacteria due to the excessive use of antibiotic. Now, in vitro factors for the optimum antibiotic action are necessary. pH of the environment, nitrofurantoin more active in the acid pH than in alkaline pH. Similarly, sulfonamides and aminoglycosides more active in alkaline pH and not in acidic pH. Components of the medium. Anionic detergent inhibit aminoglycoside. Serum proteins bind to the penicillin in varying degree. Stability of the drug is important. Aminoglycoside and chloramphenicol are stable for long period in vivo inside the body. Size of the inoculum. The larger bacterial inoculum, greater chance for the resistant mutant to emerge. The lesser, smaller size inoculum will be eradicated by the antibiotic more earlier. Metabolic activity of the microorganism. Actively and rapidly growing organisms are more receptive to drug action. And what is an ideal antibiotic? Selective toxicity means drug is harmful to the pathogen, not to the host. I have told you in detail. The selective toxicity is relative rather than absolute. Drug above its maximum tolerable dose may damage the host cell also and cause the side effect. It must be able to reach part of the human body, an ideal antibiotic, where infection is occurring. It should be broad spectrum and not causing resistance. No undesirable effects like allergic reaction, nerve damage, or damage to the kidneys or GIT occur with an ideal antibiotic. And it should be having a reasonable cost so that it should be within the reach of an person pocket. Ideally, there is no ideal antibiotic such. So again, ideal antibiotic should have stability in the body. It should have long shelf life. Can be used after manufacturing after 2 3 years. Not much drug interaction because the patient is already using different drugs, so it should not have any other interaction with the other drugs which are essential for the life saving of the patient. Given orally, not activated by the stomach acid, and it should be resistant to the stomach acid and should be released in the intestine to have absorption there and going into the blood. By injection parenterally without binding to the blood protein should have high solubility in body fluids and achieve concentration in tissue or the blood sufficiently high to inhibit or kill infectious agent. That should not induce resistance and it should preserve normal microbial flora. Now, there are certain factors which affect and modify the drug effects. That is the age and sex of the patient, body weight or body size, type of the infection, condition of the patient, species and race, genetics play some role, route or the time of administration of the antibiotic, nutritional status of the patient. Weakened patients are more prone to have more serious infection, accumulation of drugs so that there should be no toxic effect of the drug. It should be eliminated after doing its effect from the body as early as possible via kidneys or via other ways like liver or stool. Then psychological factor. Some people think the capsules are very warm and tablets are good. So give according to the psychological status of the patient. Those who like injection, they should be given injection. Other factors which affect and modify the drug are idiosyncrasy. Any untoward reaction can occur with any very good medicine. I have seen reaction with antihistamine. I have seen reaction with even delta cotril and anti-inflammatory like dexamethasone, even with the solocort of some time. One should keep in mind the local prevalence of the resistance in those areas, pharmacological properties of the agent in its various formulation like syrup, injection, tablet or whatever the available formulation is there. Likelihood of the adverse reaction, possible drug interaction with other medication and the tolerance and the cost of the. Now, combination of the different antimicrobial agents, the indications are prompt treatment in desperately ill patient suspected of having a serious microbial infection, that is to treat severe emergency infections, empiric or blind therapy where organism is not known. We just give the blind therapy or empiric therapy composed of one antibiotic for gram positive and one for the gram negative, so that to cover the life-threatening infection and patient should be able to be saved, and then it is based on available antibiogram data. Most probable 2 or 3 pathogens can be covered by different antibiotics. Before such treatment, it is essential to take the specimen to identify the real etiological agent so that we can shift the patient to that particular antibiotic to whom the bacteria are sensitive. Suspected gram-negative or Staphylococcus sepsis in immunocompromised patients and bacterial meningitis in children are true indication of the antimicrobial agents in combination and for the prompt treatment. Now, combination of the antimicrobial agent indications also have to delay emergence of the microbial mutants resistant to one drug in chronic infection by use of the second and the third drug, which is capable of killing those bacteria so they do not become resistant to one antibiotic. To prevent emergence of the bacterial resistance, as in case of active tuberculosis, so we give combination of 3 or 4 antibiotics. To treat mixed infection, as in massive trauma or those involving vascular structure injuries, to prevent treatment failure, to treat mixed infection of the aerobic and anaerobic bacteria, so we can give one for the aerobic antibiotic and the other antibiotic for the anaerobic bacteria. Now, combination of an antimicrobial agent indication number 4 is to use low doses of the toxic drug. Simultaneous use of 2 drugs permits reduction in the dose of very toxic drug, which is just unavoidable to be used but still provides satisfactory antimicrobial action. Number 5 is to achieve bactericidal synergism or synergistic effect to provide the bactericidal action. Now, effects of the combination therapies are these antibiotics act synergistically or antagonistically. So there are 4 possibilities are there. Number 1, indifference. Combined action is no greater than that of the action of the already used alone. So one antibiotic can work the same as we do combine the 2 or 3 antibiotics. Mean that combined action is same as with either component. Number 2 is addition. Here combined action is equivalent to sum of the action of the each drug when used alone. Means 1 and 1 makes 2. So it have the double potency of the antibiotic if we use the 2 antibiotics. Number 3, synergism. The combined action is significantly greater than sum of both effects. It means 1 and 1 makes instead of 2. It is called synergism. Now, one can keep in mind the combination of the antibiotic ceftriaxone and tazobactam is combined. Cefotaxime and amikacin can be combined. Ceftriaxone and azithromycin is combined. Cefodoxime and azithromycin is combined. Ceftriaxone, amikacin, and cefotaxime and azithromycin combined in different life-threatening situations where we need more than one antibiotic. Now, effects of the combination therapy, number 4 is antagonism. Means reduction in the activity of one or both components in presence of other. So instead of having the good effect, one antibiotic is going to antagonize the effect of the other antibiotic. So it means 1 and 1 makes 0 or less than 2, that is 0.5. All these effects are observed in vitro and in vivo. So indifference means A plus B is equal to A or B alone. Addition, A plus B is equal to A plus B combination. Synergism, A plus B is equal to A multiplied by B. And antagonism, A plus B is 0 or less than 0. They antagonize one another. The beautiful bird color which any person by combining the different colors of the paint cannot make like that as this painter, the God Almighty, have made this. It is all the beauty of the nature. Now, mechanism of action of antimicrobial agents. Bacterial cells grow and divide repeatedly to reach large numbers presenting an infection. Bacteria have their own enzyme for the several microbial processes like cell wall formation. Integrity of the cytoplasmic membrane is maintained. Protein synthesis is done. DNA replication occurs. RNA and nucleic acid synthesis occurs. Synthesis of the essential metabolites occur, and metabolic pathway. All these lead to the bacterial survival, and they are capable of invading the host. Antimicrobial agents, they interfere somewhere here in any of the specific process that are essential for the growth and being of the bacteria. Some work at protein synthesis, some work against RNA and nucleic acid. So the ultimately they stop the growth and division of the bacteria. Now there are five main types of the antibacterial agents grouped according to site of action or the mechanism of action. Detail I will tell you in the next lecture. So these groups or types are inhibition of the bacterial cell wall synthesis, the peptidoglycan or the component of the cell wall, the things which make the peptidoglycan. Number B is inhibition of the bacterial protein synthesis and ribosomal function. The protein factories are destroyed. Number 3 is inhibition of the bacterial nucleic acid synthesis, DNA or RNA, means the brain of the bacterial cell is destroyed. Inhibition of the bacterial cytoplasmic membrane function, disrupting cell membrane, means the boundary wall is destroyed and anything can happen now, the nude or the naked cytoplasm. Inhibition of the bacterial folate synthesis. Here one can understand the mode of action of the antibiotic. Cell membrane synthesis disrupts, as one can see. So cell membrane is gone and the content inside, they just come out because of the cell membrane is lost. Similarly, the folate inhibitor, PABA, that is going to take part in the metabolism of the cytoplasm of the bacteria, that is blocked by these antibiotics. And similarly, some RNA synthesis inhibitors and samicines, they act on 50S, 30S, or in total the ribosomes of 70S nature, and some affect on the messenger RNA, some destroy the DNA. So the end result is as one can have this peptidoglycan lysis, and ultimately the bacteria dies. Now, action of the specific groups of the antimicrobial cell wall synthesis is inhibited by beta-lactam such as penicillins and cephalosporin, which inhibit peptidoglycan polymerization, and vancomycin combines with the cell wall substrate, so the defective cell wall substrate leading to the defective cell wall manufacturing and ultimately cell wall lysis. Tetracyclines compete with the incoming transfer RNA molecules, so the proper protein synthesis messaging is not relayed. Polymyxin disrupt plasma membrane, causing leakage of the cytoplasmic content. As you know, the boundary wall is destroyed. Quinolones bind to the bacterial complex of the DNA and DNA gyres, blocking DNA replication, and the brain is damaged. Nitroimidazole damage the DNA of the bacteria. Rifampicin block RNA synthesis by binding to the DNA-directed RNA polymerase, so the protein synthesis factory is lost. Now, aminoglycosides, tetracycline, chloramphenicol, erythromycin, acrylamycin, all interfere with the ribosome function. Aminoglycoside cause genetic message to be misread and a defective protein to be produced. Sulfonamides and trimethoprim block synthesis of the folate needed for the DNA replication, as I have shown you in the slide. The synthetic sulfonamides antibiotic interfere with the nucleic acid synthesis. Chloramphenicol prevents linking of the amino acid to the growing proteins, and puromycin causes protein chain to terminate prematurely, releasing an incomplete protein. Now, coming to the toxicology of antimicrobial agents, the antibiotic can be directly toxic, can interact with the other drugs to increase their toxicity also. Accumulation effect can alter microbial flora to cause infection by saprophytic organisms which are just lying there and allow these bacteria to invade the body. They can cause allergic reaction, as penicillin can cause immediate or delayed hypertensive reaction. Cutaneous reaction can occur with every class of antimicrobial agents. Hematologic reactions can occur like life-threatening blood dyscrasia, as with the chloramphenicol, that is aplastic anemia, hemolytic anemia due to the sulfonamide in patient with who lack enzyme glucose 6-phosphate dehydrogenase. So here concern see the adverse drug reaction. There is classification of that: type 1 reaction, 2, type B, type C, type D, type E. These are the different kind of a reaction which occur in the body, so that patient can have drug allergy like here, and patient can also have the hematological toxicity, that is thrombocytopenia, leukopenia, anemia, and myelodepression. That is the all because of hematological toxicity of the antibiotic. Now, toxicity can be causing allergic reaction also, and different kind of problems. And here one can see the adverse reaction like diarrhea, and kidneys have been damaged, and sometimes the ears of the patient that is damaged because of toxicity of the aminoglycoside. And some adverse reaction are like this: they are having the shivering, the rash, and skin reaction, and other reaction which can occur because of the drug. Depression of the blood platelet activity with many agents. That antibiotic also alter gut flora by different antibiotics cause overgrowth of the Clostridium difficile. These produce a toxin that cause diarrhea and even pseudomembranous colitis. Alteration of the intestinal flora so result in the overgrowth of the candida in mouth, vagina, or gastrointestinal tract. As many antibiotics are metabolized or liver, they can damage to the liver, like isoniazid for the TB is dangerous for the liver. Damage to the kidneys by the aminoglycoside. I have shown you the slide. And neurological toxicity by the aminoglycoside can damage auditory or better, the ears of the patient have gone. And here one can see the vaginal thrush of the patient, that is because of the overgrowth of this fungus due to the antibiotic usage. And similarly, the oral candidiasis can occur because of the antibiotic overuse. So that is the end of the lecture about the antibiotic basic, and hope so you may have liked this lecture. If you have liked this, please just subscribe and share it with the others. And if you don't like, please tell me so that I can improve it more for your liking. And thank you very much for all.